Hello and welcome back to the live studio of ECR 2023. We're going to be speaking about sustainability, especially in the medical and radiology field. We all feel the need to adjust our lifestyles and consumption patterns and even economic activities to protect our shared planet. But sometimes the first steps, although necessary, seem daunting. Philips has taken the lead in not only adjusting their own practices internally to create more sustainable systems, but are showing others the way, from the building blocks of the supply chain through the practices of medical institutions. As the leader for circular solutions at Philips, Ariella Shuster drives access to innovative healthcare solutions that can help them to act responsibly toward society and towards our planet. Welcome to the live studio at ECR here in 2023.
Happy to be here.
Thank you for joining us. Thank you very much. You just start by describing the term circular economy. I imagine it can be all-encompassing or very specific. What does it mean to you in your position at Philips?
Yeah, well, maybe we can start with the basics, right? Because we're also regularly working with the linear economy concept, which is our day-to-day consumption concept, right? We take resources from the planet, we process them, we make something out of it, a product, and then we enjoy that product usually, and then we just dispose it and it goes to waste. So it's take, make, dispose, take, make, dispose. And circular economy is basically challenging these concepts, these linear concepts, and it's in a way imitating nature, because if you think about it, in nature there's no waste, right? I mean, a waste of one system is just the resources for another system.
I have a garden, I'm fully aware. Yes.
Okay, exactly. That's a great example, a great example. And this is so ingrained in our society and in the way that we consume, as you rightly mentioned. And circular economy is basically saying, hey, let's keep the resources within the system. Let's extract the value as much as we can from those systems. So it basically decouples between value generation and just consuming resources, finite resources, virgin resources, which in a way is linked, in our minds and in the way that we're working. Now it's the same for healthcare. I mean, if we think about healthcare today, we have aging population. We still have 50% of the population that does not have access to basic healthcare. We have chronic diseases that is increasing. And then we have the climate change and we have the scarcity of materials. So circular economy comes into play and basically says, hey, how can we create value models, delivering value care models that does not extract value, that are more sustainable and friendly to the environment, and that contribute to an efficient and effective and accessible healthcare. So it really goes hand in hand. How can we deliver care without caring about the environment?
Mm-hmm. Exactly. That makes sense. Pertaining to healthcare, how does this circularity, how is it actually implemented, and what effects does it actually bring to actual healthcare situations?
Yeah, it's a good question, because in a way, circular solutions is still not that common. It's a little bit an uncharted area, if you will. So when we talk about sustainable healthcare or sustainable radiology, usually you engage in a conversation and it goes into decarbonizing, into renewable energies, into how can we save energy, which is super important, of course. But when you think about circular solutions, they promote those environmental benefits, but they also eliminate waste. They contribute positively to biodiversity. So there is like a quadruple, and they promote access to care because they're more affordable in many ways. So basically, it's like a quadruple effect on the environment and on social justice, I would even say healthcare equality. So that's how it comes into play. Now, practically, let's go into the practical details. Please. So it starts with dematerializing. I mean, can we actually have solutions that do not require material to extract new materials? So it starts there. Then we go into extending lifetime of products. So why don't we, I mean, we have the big irons, the MR, the CTs, I mean, why don't we keep them and just extend their lives with software and with the latest features and so forth? But then at some point, a healthcare, a caregiver says, okay, I want to replace that system. So what do? So yes, they can upgrade, but then they can uptrade as well. So we trade in the system, we take it back, and then we see what's the maximum value that we can extract out of this system. So we can repurpose it. I mean, basically, we have a very strict system of looking into, okay, what's the best way to deliver value out of that system? So some systems will be eligible for a second life. And then we have a very rigorous process to give them a second life where they can continue and treat and save lives, in other customers or other hospitals. We can also recover parts of those systems. And and after we recover parts, or if the systems are too old or not in a situation where we can really recover, then we make sure that we dispose them responsibly. So we have a network of recyclers worldwide. And that's a bit of the concept of closing the loop, saying that we would like to close the loop for every system that becomes available for us to make sure that we extract the maximum value as a society, I would say, and then to make sure that the rest is being disposed responsibly and nothing goes to landfill.
Closing the loop, that's kind of a binary end status solution. Where are you as a company on that journey? How well is it being accepted and implemented within radiology?
Yeah, that's a good question. I think that we really need to push the boundaries of traditional ways of looking at radiology, right? Look at it more. Patient care and patient outcome is obviously the essence of radiology. But then how can we deliver care without doing any harm? And that's why I'm really excited about this collaboration and about the momentum that we're having in ECR this year, because basically it's about a collaboration between healthcare leaders, between young professionals, between the industry, between organizations like Healthcare Without Harm and ESR, which we are collaborating today to deliver and to raise the awareness. So I would be happy to say that, hey, we're all in, everyone is all in. Well, not yet. We see an exponential, I think, interest, but there's still a way to go to unlock traditional ways of thinking and understanding the value that this closing the loop brings to society at large. Mm-hmm. Mm-hmm.
Radiology, as anybody can attest to that walks out on the exhibition floor and interacts with industry, is a section of healthcare very much motivated by and driven by technological advancement. And now with AI, big data computing, it's even more of a consumption of pure energy in the form of electricity. How does that fit into Philips' model, where traditionally most companies out there are bringing the newest, best machines onto the market and pushing those? How do you convince these really tech-hungry consumers, let's say, that you're trying to close the loop, you're trying to repurpose, that this machine is perfect for them, even though it is a model from, say, 2015?
Yeah, tech hungry. I liked it. So maybe two parts to my answer to this question. First of all, we harness technology. We take technology into the innovative way of rethinking solutions. So to give an example, the helium-free operations MR, right? So if you look at the previous models, they used 1,400 liters of helium, right? And the helium-free uses 7 liters, from 1,400 to 7. This is dematerializing, so this is in a way a circular solution because it's the most sophisticated one, because you embed in your design the circular concepts. The system doesn't need to consume additional helium during its lifetime, and helium is a scarce resource. So this is how we harness technology, and the whole cooling system of this MR, which is a technology that we harness to actually be a more sustainable radiology. Another example could be, which is again technology, like the spectral technology for CT. So, based on studies, we learned that there's a 25% reduction in repeated scans and 30% reduction in follow-up scans. So this is an efficient healthcare. Again, first, it's the fastest path for diagnosis and treatment of the patient, which is in the heart of what we do. But then we create an efficient stream, which is less carbonization, more efficiency, and then it also frees up more resources for healthcare to be more affordable and more accessible. So again, embracing technology. Look at digital health, remote tools, collaboration tools, all of them are dematerialized, or AI, as you rightly mentioned. All of this is technology that goes hand in hand with sustainable radiology and circular solutions. Mm-hmm. Now, you touched about how can we talk about perception of technology and circular solutions? I love this question because we're stuck with concepts, traditional concepts that we're kind of, we need to challenge this status quo. I mean, a system that is coming back is coming back to the factory, to the OEM factory. Now it is being sterilized, it is being tested. First of all, it's being the installation process goes with really expert people that handle it with care. It goes back, it sterilizes, it passes through all the tests that are needed. It should pass all the acceptance test requirements. We're replacing parts, obsolete parts, or parts that we need to replace. The system is being assembled, integrated, and tested to the exact same specification of a new system. Then we, do the cosmetics, so it also looks as new, and it's just as good as new. And it's performing, it's reliable as good as new, it gets the same warranty. And actually, we've tried some experts and they couldn't distinguish between a new system and the second life system. So I say let's challenge the status quo in our thinking and change our perception.
It's very difficult. We've built a system based on newest, biggest, brightest, boldest.
Exactly.
And, right, to change that mentality is very difficult. But I compliment Philips for taking that step. It's a bold step. Your conversations with practitioners, technologists, from your perception, are you pushing ideas to them and, like you said, changing this ideology, this structure of thinking? Are you pushing that out, or are you seeing as much of it being asked of Philips from practitioners, from people in charge of institutions, etc.?
It varies. I'm happy to say that today we're engaging in deeper conversations. If, a few years ago it was more into pushing and kind of influencing and, changing, today we're actually sometimes being challenged, or we're being pulled into conversations. How can we co-create? How can we rethink? There are different stages of where, worldwide, where we see hospitals in different stages. So some are in very early stages, and we engaged, during ECR with many of them. But what I found is that they all are very curious. So even if they're in the beginning a little bit embarrassed, well, we haven't done much, and then I say, okay, so it's a great point to start, right? Then we open the conversation, and they're all in. So how can we start? What should we do? How can we understand our energy consumption? Who can help us? What different aspects of sustainable radiology or circular solutions can we start to adopt? Or it can be small steps. And then you have the professionals, that with them we're kind of creating the community, the thought leadership, the call for action, the co-creation. So it's really, really encouraging to see.
What do you mean by professionals?
The ones that are leading the pack.
Okay. In this drive towards sustainability, circularization. Yeah. Okay. Fantastic. Mm-hmm. We touched on this with changing the mindset, but what mindset and actual business model changes need to take place to allow for this, let's call it a revolution or a dramatic change, let's say, allow for that to take place?
It is revolutionary, and that's a very good question. If we think about business models, most of them today in our consumption environment are transactional. When you talk about circularity, it's not about transactions. It's about intimacy. It's about, let's talk about, the theme of 2023 ECR is the cycle of life, right? So if I adopt this metaphor also on a product, it has a cycle of life. And what we perceive today as end of life, it's not necessarily the end of life, right? I mean, how can we regenerate and make more value out of it? So, yeah, it's just about open your mind and think differently. Yeah.
So we need to make all of the consumers have a Buddhist mindset that all products will be reborn and reused.
Yeah. I mean, think about an MR, for example, or a CT. We reuse roughly about 80% of the materials from a system. So imagine they're perfectly good. Mm-hmm. I was engaged yesterday in a conversation with one of the radiographers. He's in interventional radiology. And he was working after 10 years that he was working with a system that really saved lives and treated people like, 6 or 8 procedures per day. And then one day, they decide to replace the system. Unfortunately, that system, the loop was not closed. And yeah, I don't know, he has been told that it's going to scrap. And he was shocked. He said, but why? Look at it. I mean, it serves 6 to 8 patients a day. I mean, he was really disturbed with that. And he told me that story yesterday, and it really touched me because it's really a waste. I mean, the healthcare industry really needs these resources, right? We have 50% of people that still don't have access, and then we just treat it as if there's no tomorrow.
Are there any myths or controversies involved in this subject matter within radiology or healthcare in general that we should get on the table? Something that you confront commonly and you think, no, that's actually not how it is. Your ideology is false.
I would like to take it to the very basics. Go back to language and concepts. So, can I ask you a question?
You'll be the first, but sure.
Okay, let's try. When I say the word new, what associations comes into your mind when I say new?
Packaging, shiny paint, cleanliness.
Yeah, exactly. And what I would say, and you touched it, in one of your prior questions about technology and so forth, and we say, let's rethink what new is. I mean, new does not necessarily need to be linked into extracting new resources, right? I mean, how come new is not associated with value creation? And these are concepts that are ingrained and we're wired this way. But value does not need to be generated only from new products, right? So let's think about renewed. Same goes for now, the exercise. Waste.
Now everybody's paying attention. Waste. I think of, me personally, I think of excess of mounds. Which with my garden, I actually should already be pre-programmed to think of opportunity with compost and nutrition. But you have me, yeah. I do think of the negative effects of that.
Yeah. And again, that's how we're kind of constructed, right? Waste, we can throw it. Now, a hospital bed generates 13 kilograms of waste every day. Every day. Now, how can we treat that waste in a way? First of all, maybe it's not waste. Maybe it's a resource for another system, right? So the notion of we take something which is precious, which is limited, which has boundaries, we use it, and then we just, throw it away. Well, where is away is our planet, right? There's no away, it's the planet. But so that's my invitation, to change the how we're wired, to think about waste as a resource. And, then I think business models will emerge out of that, right? And a new thinking will emerge. It's still the beginning. There are endless opportunities. 2 more words that I would like to challenge. It's, first of all, the they. Right? I mean, I'm super busy. I have many patients to do. They can take care of it, or whomever. there are no they. You know, it's us, it's me, there are no they. And I was so happy to engage with people that initially that's what, you know, was their mindset. And then we found that actually they can do small things in their daily practice, you know, and it, like a nice conversation where people said, hey, we recycle at home, but when we enter our department, suddenly it's not. So where is it? I mean, suddenly it's not applicable. So how can you apply that, you know, in the radiology? So that's also nice. Yeah, so it's they, and then it's that like we throw the waste somewhere, right? So they, somewhere, it's like, it's not our space, it's somewhere else. Somewhere is the planet.
At the same time, it's difficult because when you internalize the problem for yourself, then the they are the people who are not pulling their part. So there's a free rider program. Just a question between for me, and I know somebody representing industry, this is a very difficult question, but is there a place for government to recuperate costs of externalities in order to drive these innovations forward?
Oh, yes. Oh, yes. There's a huge place for governments, for NGOs, for industry, and for the hospitals as procuring, you know, to procure responsibly. If we talk about governments, I mean, look at legislation. Let's go back to the waste definition. We need to change the waste definitions because there are countries today where we cannot, you know, enter reused or renewed material because it's waste. How come it's waste? It can save people's lives, but the definition is waste. So I think there's a lot for governments to do, and I think it's starting to happen. But we're still in the beginning of the journey, and that's why it's that collaboration that we need, and we're trying to, you know, create some community around it, you know, to share best practices, to have everyone to collaborate, to understand, and you know, businesses will, and models and practices, and they will continue to emerge.
That really comes through in your space, in your booth area, booth. It's a wing, let's call it. Really interactive, really collaborative, trying to pull in actors into conversations, and it's very effective the way it's set up there. So congratulations on that. It's very well done. What are some of the barriers to a more vigorous adaptation or adoption of a circular-based economy, especially within medicine?
Yeah, so first of all, naturally, when we talk about breakthrough, there are always barriers because a breakthrough is something that you need to break something, right? First, yeah. So it comes without saying. We touched some of them, right? Government regulations, legislation. But I'm happy to see this changing now with, you know, reporting sustainability, now requirements and regulations around it and so forth. So I'm happy to see that it's changing. Conceptual thinking about what new and what waste is, we've discussed. Reverse logistics, right? I mean, the increasing logistics cost, which sometimes really doesn't make sense, but more importantly, how do we do that sustainably, right? Because a system that will, I don't know, come back or travel half of the world to be repurposed, does this make sense? So not necessarily. We need to find solutions maybe to repurpose locally when it doesn't make sense to bring systems back into a hub or something like that. So we really need to circular solutions it's not on the expense of anything. We need to think smartly on how to do that.
That's a good point, shipping a 15-ton MRI halfway around the world to send it back again.
Right, and that's why we have those upgrade packages where we can actually strip out the magnet and just, you know, basically reconfigure the system in the site itself because it just doesn't make sense to ship it half of the world. Yeah, so I would say reverse logistics for sure. I think we've touched the main.
Mostly, yeah. But the reverse logistics is something I hadn't thought about. That's a very important part of it.
Yeah.
There is a cost for everything, whether it be ecologic, economic, socially.
And maybe another one, I wouldn't call it a barrier, but I would say that it's an evolving challenge, which is really the design. I mean, how do we design for circularity? So it's not just the eco-design to design for less energy consumption or to dematerialize, as we discussed before, but how do we design in a more modular way so it's easier to disassemble and to assemble, to reconfigure, for a system to be upgradable, so that's also something that we're really working on, changing the conceptual design around that. Yeah.
What is your advice, just kind of a closing thought? Somebody's possibly watching this, somebody not quite in the mix of sustainability, but they want to take action now. What do you recommend as being the first steps, the best practice to have as much impact as quickly as possible?
I want to share a story that at least was a defining moment for me. A few years ago, my daughter, in her birthday, she had a birthday, and I asked her, what should we buy you as a present? And she said, and I shared that story once already because it's for me, it really was a profound moment. And she said, no, Mom, I don't need anything. I said, well, birthday, come on, help me out here. And okay, we had some conversation. It's a teenager, so it's not that. And then she said, you know what? If you want to buy something, buy a second hand. Well, fine, I did that. And then she said, and by the way, it's your generation that caused all of this overconsumption, so, maybe you should also do something about it and fix it.
What birthday was it again?
Sorry?
How old?
She was 16.
Sounds about right. Okay.
But today she's over 20 and she's, living in a total sustainable way of life, to start with personally. So if we kind of have this was an enlightening moment for me, and I learned a lot from her and from her generation, right? They're opening our eyes. So first of all, I hope that many will have this enlightening moment throughout this ECR, because this is being discussed a lot. And then start small. Start small. Start with having maybe ambassadors for sustainability in the organization, just to talk about it, to create awareness, create some community, to have some conversation. Can get a lot of help regarding, energy consumption, baselines, just where we are at all, just measure and start with some, targets or easy targets to start with. I think it starts with that. And then when the notion is there, then you can build on it and make bigger steps. But that would be and we have already, the community will help to share best practices around that. But start small, quick wins, raise awareness, and we're going to move the needle, I'm sure.
Well, Ariella, thank you so much for your sincere dedication to making these systems possible and driving them forward in healthcare in general and radiology specifically. Thank you.
Thank you.
It has been fascinating to witness the efforts and the seriousness which with Philips is leading in this important field. Thank you as well for taking part in this industry session. We will be following at 2 o'clock Central Europe for a conversation with Clarify as they present their expanded AI suite, also a topic we discussed. It's going to be a very interesting combination. They have a much deeper portfolio than the last time we spoke with them last year, and it's going to be great to find out exactly what benefits this is bringing to practitioners and ultimately patients. So join us at 2 o'clock for the following session. Thank you very much.